Yuma is a major crossing point for many migrants entering the United States, and the country is feeling the strain of caring for migrants. Cronkite News reporter Alyssa Munoz went down to the border to hear about some of the problems.
At the regional border clinic in Somerton, thousands of migrants get their first taste of American hospitality.
Agreed that this is a humanitarian response that we're doing because the people that come in are leaving their countries for a very good reason.
Border Health conducts health screenings including COVID tests, and they help migrants get to their next destination in the U.S.
How are we assisting the families that are coming into this country to integrate into our society, to help the families to have the children go to school, the mom and dad find a job, as we allow them to stay here and wait for a court hearing.
But all this goodwill comes at a cost. Border Health is spending millions of dollars and countless hours of time that could be going towards some of their other efforts.
So we have a lot of work to do in rural communities and isolated and disadvantaged.
Behind this border wall is San Luis, Sonora, Mexico. Thousands are waiting to cross this border seeking asylum. Other nonprofits in the area are also feeling the pressure of tens of thousands of immigrants seeking asylum.
Some have come in by taxi, some have come in by Uber, some have even walked in the door.
Robert Trenchel is the president and CEO of the Yuma Regional Medical Center. His facility is bearing the brunt of the health crisis at the Yuma border and getting little help from the federal government.
We treated many of those migrants, or if not all those migrants that were here and needed emergent or urgent care. This was the only place they could really come to. We delivered over $20 million in uncompensated care during that 6-month period from December 21 to May of 22 to those migrants.
Trenchel says the hospital is financially stable, but if they have to handle another surge like they experienced in the winter and spring of last year, it would hurt.
If that surge would occur again or another 1 or 2 times, that's concerning.
According to the U.S. Customs and Border Protection, so far this year more than 91,000 migrants have been processed at the Yuma border. In fiscal year 2022, they saw close to 100,000 migrants.
It's not just what the national issues are and what the city's issues are, but the individuals that are coming.
The mayor of Yuma, Douglas Nichols, understands what is happening in the clinics, shelters, and hospitals of his city, and he's been calling on the federal government to help for years, even if it's just giving the border towns some advance notice before making decisions on immigration.
Trying to be out ahead of these large issues so when they end up coming up, we are in a better position.
Trenchel goes a step further. He wants the federal government to help pay for the care his facility gives to migrants every day.
You know, it was a federal government initiative to open up the borders and let these individuals in, and we're paying the price for that, quite frankly.
Aguirre agrees the federal government is largely to blame for the crisis.
I wish that the immigration law will be different, that people do not have to go through these extremes in crossing the border.
But until the complicated politics of the border are fixed, it will fall on the men and women who live along the border to provide aid. It could be as small as a bus pass or as big as a complicated medical procedure. But just on the other side of that wall are thousands more waiting for a chance to come to America. In Yuma, Alyssa Munoz, Cronkite News.
The Yuma Regional Medical Center says much of the emergency care they are providing is for mothers and newborns, including the construction of a temporary hotel for mothers when their children are receiving care.